Antiviral agents. So antiviral agents are used to treat herpes or HSV, cytomegalovirus or CMV, influenza or the flu, varicella or varicella zoster, and then hepatitis. So indication, it is all dependent on the agent. You guys are going to learn which one is used to treat what later on during this lecture. And so again, it's used for HSV, CMV, influenza, VZV, hepatitis, and so on. Now, therapeutic action, generally speaking, these medications are given to slow down or prevent the replication or multiplication of the virus. So when we slow it down enough, right, when the number is low, we weaken it enough, it can allow the body, the patient's body, to eliminate the virus or at least make it weak enough so it stays dormant, and it prevents the patients from having some signs and symptoms of the illness. Side effects are dependent on the agent. So please know the highlighted one, but depending on which medication we are talking about, it may have a variation of side effects. So acyclovir can cause nausea, diarrhea, headache, burning when topically applied. Amantadine and rimantadine can cause insomnia, nervousness, lightheadedness, anorexia, nausea, and it can also have anticholinergic effects, can cause orthostatic hypotension, and it can cause blurred vision. So please remember that for amantadine and rimantadine. So as you can see, these side effects are a little bit more severe compared to the acyclovir. Now, ganciclovir can cause bone marrow toxicity, nausea, vomiting, headaches, and seizures. So also remember that. Other medications such as ribavirin can cause rash, conjunctivitis, anemia, and mild bronchospasm. Zidovudine can cause bone marrow suppression, nausea, and headache. Now, some contraindications to this medication include severe allergic reactions to it, and know that amantadine is contraindicated in lactating women and children less than 12 months old, and for patients with eczematous rash. Ribavirin is contraindicated in pregnant women and their male sexual partners because of the teratogenicity or its chances of affecting the developing fetus. Nursing actions obviously assess for effects and side effects, include patient education regarding the purpose, side effects, and compliance. Again, it doesn't mean that they're asymptomatic, that they can just stop taking the medication. And examples of drugs in this class and their indication include the following. So medications to treat herpes simplex 1 and 2, and then herpes zoster and varicella zoster. So the herpes and the zosters are your acyclovir and valacyclovir. For hepatitis C, we use multiple combination drugs and antiviral. You don't have to remember this, but know that they are here and that you may see some patients that are on it. And so sofosbuvir, ledipasvir with sofosbuvir, so combination. And notice that many of this antiviral medication end with vir. So again, hepatitis C, you don't have to remember it. Know that they're here. And then hepatitis B medication include entecavir, lamivudine, and tenofovir. Influenza A, we use amantadine and rimantadine. And then influenza A and B, we use zanamivir and oseltamivir. The most common one that we see being used is oseltamivir or Tamiflu. So for your testing purposes, know that oseltamivir or Tamiflu is used for influenza A and B. Now we have also treatment for respiratory syncytial virus or RSV for children is ribavirin, and then for cytomegalovirus or CMV, we use cidofovir, and then another combination, it can also treat both cytomegalovirus and herpes simplex is foscarnet. So these are your medications. If it's highlighted, it means that most likely it is going to be on the test, so please remember them. And you are not going to be tested on the HIV or AIDS agents, but I just want you to know that they are here. We do have a special population that are suffering from HIV or have AIDS. And so please read this and especially use this as a resource, especially in caring for these patients. And so indications for this, so it can be used as both for treatment and exposure. So some patients may have been exposed by their partners to HIV or human immunodeficiency virus, so that's why they may be on these agents. And sometimes some of them may actually have the infection of human immunodeficiency virus. Now, in order to be diagnosed with AIDS or acquired immunodeficiency syndrome, you have to have certain numbers. So you have to have a certain number of your CD4 cells. And so I don't want to go over in so much detail when it comes to that because it can tend to get a little bit complicated. But anyhow, the goal for treatment is to have a viral load of less than 50 copies and for CD4 cells to be greater than 200 cells. And hopefully the patient does not develop opportunistic infection, which is quite common among patients with HIV or AIDS. Side effects of medications can cause nausea, vomiting, diarrhea, but something to remember, it's because these are antiviral, it can suppress the immune system and the bone marrow. So for this medication, it does suppresses the bone marrow and it can lead to osteoporosis. In addition, the protease inhibitors can actually cause diabetes and dyslipidemia. Some precautions, so be very careful if we are also giving medications or they're receiving medications for hepatitis C and tuberculosis, especially because of toxicity and interactions. So again, these drugs can have multiple drug interactions, so please make sure you're checking your reference manuals. Contraindications, obviously, if there's a known allergy or intolerable side effects, then we shouldn't be giving it to the patient. So nursing action. So part of what we do for these patients, if we know that we're giving these medications for HIV or AIDS, we need to follow up the viral load and CD4, right? How do we know that we're accomplishing our goals? How do we know that this treatment is actually effective? Well, we need to follow the viral load and the CD4 counts. In addition, we have to monitor for the side effects. And so it just depends on the patient, the condition, as well as the medication. And then very important part is also to monitor for opportunistic infection. Again, one of our goals for treatment is to prevent opportunistic infection. So if the patient keeps on getting opportunistic infection, right, we need to ask ourselves, is the treatment working? And if it's not, what else can we do about it, right? Anyhow, examples of drugs under this class, we have the reverse transcriptase inhibitors or RTI. So they basically inhibit DNA synthesis. So you have the nucleoside. So nucleoside includes zidovudine. And then you have the non-nucleoside, which is efavirenz. And then you have the nucleotide, which is tenofovir. You also have the protease inhibitor, which inhibits the protease retroviral enzyme. So that would be ritonavir. And there are also the fusion entry inhibitors. So this inhibits the HIV fusion to the host CD4 T lymphocyte, which is enfuvirtide. As you can see, these are very hard to pronounce. Anyway, so I hope this is helpful. I'll see you guys next week.